So you spoke to sort of the CEO turnover and the fact that we're kind of living in this fee-for-service world, and yet everybody's talking about value-based care. And what I find, and I'm sure a lot of people in the room find, is there is an ear to MLP and other ways to reduce costs, but the people that are in charge are still in the fee-for-service world. And so I guess I just want to ask, how much more time do you think it's going to take before we actually kind of leap over that hurdle? Because it's so frustrating because we're right on the cusp, but we're not there yet.
Yeah. I mean, it's a great question, right? And there's an emotional part to this, right? Isn't it? I mean, when you're seeing us as a society unnecessarily not use the best use of resources, it's frustrating, and I get it. And I think that's a great question. I think we're there now, though. I think that's my message. We are there right now. Why MLP? Why now? And the reason is because we're on both sides. We're in this fee-for-service world, but we're also in this value world. And CMS has made it clear, HHS has made it clear as well. By 2018, they expect 75% of contracts to be some kind of value-based contract. And it's not a spigot, right? We can't turn it on all of a sudden, get ready to do the social determinants and this alignment. We've got to build the infrastructure. So I think you are able to make those pitches now. The key is a lot of folks aren't at the top of that chain. If you remember that step ladder I showed to the ACO side, some of them are only in the bundled payment side, but there's opportunities there, right? It's on a fee-for-service platform, but you have to manage a care on the post-acute side as well. So for instance, in the past, you had a surgery, someone's homeless, you discharge them to a homeless shelter, hospital saying, that's not my problem. Today, if that person's in a bundle payment, you're going to get hit when they come back to that hospital. So all of a sudden, you're starting to work a little bit more aggressively to make sure they have a post-acute care. Those opportunities are there. They're not going anywhere. It's just a matter of understanding that particular market, that particular system, and framing the conversation in that way.